Hello, my name is Jordan Tan and this is my paleopathology assignment. The purpose of this report is to examine a skeleton and review each bone to search for any possible diseases. This is being done to determine how well preserved the body was and to find out information about how the person lived. Lastly, we are trying to figure out whether or not injuries or diseases sustained were the cause of death or if they were a contributing factor. The skeleton that is being examined is a young female adult between the ages of 15 to 25 and no older than 30. Their origin is in Tyrol, Austria. She lived between the years 1500 and 1800 and was approximately 159 centimeters. The skeleton was in fair condition. There are a few bones missing, but a lot of post-mortem damage. The green stain is likely due to jewelry or coins made from copper or bronze that were left on the body. Most of the damages are minor, like the pelvis, besides the pelvis and the scapula. And the skeleton was almost complete. There are very few missing bones. Not many of the lesions were present throughout the skeleton, and most of the lesions were made after death. We know this because the fractures are brittle and rigid, with no signs of bone regeneration or healing. So the pseudopathology versus pathological lesions. There are no pseudopathological lesions found within the individual. They were very few minor pathological lesions with this individual. There are small stress fractures, which indicates that there are some sort of overworking or minor trauma, and no lesions caused by diseases which were found on the individual. So the first lesion was at the temporal. There was a depression near the acoustic meatus. The size of the depression is a bit smaller than the external acoustic meatus, with no visible fracture lines. The second one is in the zygomatic. Both the left and the right zygomatic bones are fractured. In the middle, where the arches, where the bone is the thinnest, the arrows are indicating where it is. The third one is in the mandible. There's a fracture line near the mental protuberance on the right side, and it does not appear to be fully fractured. Fourth is the manubrium. There's an angled breakage across the center of the manubrium on the anterior side, and on the posterior end it looks like there has been some healing, but not completely. Fifth one is the sternal body. There are some fractures. There are some small depressions on the anterior surface of the sternal body near the transverse ridges, and the bone looks very porous but not that large in size. The sixth one is C5, the small transverse fracture on the spinous process. C6, there's a small transverse fracture on the right transverse process, creating a crack on the right transverse foramen, and there's a large segmental fracture on the left transverse process, which creates a large opening on the left transverse foramen. C7 has a large fracture on the left transverse process, misshapening the transverse foramen. T1 has a large fracture on the right transverse process, completely cutting off the distal end of the process. T2 has a superior anterior fracture on the body of the T2. The T3 has a large segmental fracture on the right transverse process, which completely cuts off the horn. In T6, the large segmental fracture on the right transverse process, which completely cuts off the horn there. And T7, the large segmental fracture on both the transverse processes, completely cuts off the horn, and the right transverse process has a bit more bone intact. L1, there's a small segmental fracture on the right transverse processes, which makes the horn a bit uneven to each other, and there's a small depression on the body of L1. For L4, there's a small segmental fracture on both the transverse processes, making the horns a little uneven to each other, and the left transverse process has a bit more bone salvage than the right. In L5, there's a very small segmental fracture on the right superior transverse process. R1, there's a considerably large oblique fracture on the distal end of R1, and the rest of the bone is missing in R1, or it's not shown. In R2, the oblique fracture on the R2 superior shaft, and there is some breakage on both the distal and end of R2s. For R3, there's a breakage on the distal end of R3, Breakage on the distal ends of both R4s. The left rib has a lot less bone salvage than the right. The breakage was very uneven. For R5, the left R5 has a transverse fracture in the middle of the shaft, completely breaking the rib in two parts. And the right R5 has a brittle breakage on the distal end of the bone. For the R7, the left R7 has a transverse fracture in the middle of the shaft, which completely breaks the rib in two parts as well. R9, the left R9 has a transverse fracture in the middle of the shaft, which as well broke the rib into two parts. For the R10, there is a brittle breakage on the distal end of the R10. And the floating rib for R11 has a transverse fracture in the middle of the shaft, which completely breaks it into two parts. For the scapula, there was major breakage in both the infraspinal fossae, a completely missing area as well as the lateral border. The left scapula has brittle breakage on the superior angle, and the right scapula is even more damaged as it's missing the superior angle, supraspinous fossa, and the proximal half of the fossa spine. The humerus has a depression fracture on the right humerus head. It's porous but not large. There is a hairline fracture on the shaft of the right radius. The right ulna has an oblique fracture. It's slightly diagonal on the styloid process. And the left ulna has a depression fracture at the distal end of the bone just above the styloid process. In the phalanges, the left hand proximal phalanx 3 and immediate phalanx 4 both have transverse fractures in the middle of the shaft, which completely breaks the bone in two and are missing. 3 is the sacrum. Large depression fracture in the left lateral side of the sacrum. No other fracture lines associated with the breakage. In the ilium, it has an intermediate sized depression fractures located in the center of the ilium, where the bone is the thinnest on both. For the ischium, all of the right ischium bone has been broken and is missing. The fracture goes all the way up to the pubic bone, crest, and symphysis. The right actabellum is fractured due to the segmental fracture as well, and the left ischium is still intact. The pubis, as mentioned above, the right pubis bone is completely missing due to the segmental fracture, and the left pubic bone is segmentally fractured with the broken piece missing. The hip socket, both of the hip sockets are damaged due to the segmental fractures as stated above. And in the tibia, there are very minor stress fractures on the left tibia, and it is very close to the fibular notch in the medial malleus. So, what does this skeletal pathological evidence tell us about the overall health of the skeleton? It tells us that there's no major lesions, and most of them are antemortem. There's none antemortem. There is no eburnation present. Bone formations are all normal throughout this individual's life, and there is no osteoporosis. The bone's density is good. It is small pores, dense, and no osteogenesis imperfecta or other bone-related diseases. There was no infections present. The individuals seemed like they had a good nutrition because there was no problems with bone growing or rebuilding, and overall they were quite healthy. With the osteological paradox, in the skeleton observed earlier, they showed no signs of illness, which could have been due to the osteological paradox, as they died at a young age and may not have had the time for the disease to spread towards the bones. As mentioned earlier, they were approximately 15 to 25 years old. And even though the person seemed healthy by looking at the condition of their bones, I cannot rule out the fact that they were free of any diseases due to the paradox. It could have happened, and the disease just didn't have time to spread to the bones. These are the references, and that's the end of my presentation. Thank you.